Well, the United Nations war on drugs. We're going to switch to something very serious now. It's now being labeled a failure. A new shadow report by the International Drug Policy Consortium slamming the UN, saying that their policies have resulted in millions of people killed. So as the need to combat the opioid crisis in America continues to grow, what needs to be done to help those struggling with addictions? Here now to weigh in is our panel: radiologist Dr. Nicole Saphier, and Democratic strategist Roger Fisk, and Republican strategist Dan Palmer. Thank you all for joining us. Appreciate it this morning.
Thanks for having us.
So let's first bring up these statistics, because they really are horrifying, is the word for it. A 145% increase of drug-related deaths worldwide from 2011 to 2015, over 71,000 overdose deaths in the U.S. in 2017. So, Dr. Saphier, I'll begin with you. What do we need to do to stop this rise in deaths?
Well, gosh, that's a complex question there, Heather. But let me tell you, it's a multifaceted approach, the way to combat it. And part of it is immigration control reform, tight borders to stop the illegal forms coming across the borders. But we absolutely need increased access to treatment, addiction treatment. It's lifelong. Without that, you will not have recovery for those who are already addicted. But let me tell you that having an insurance card doesn't equate to having good addiction treatment. So just because we've already had ample coverage provided by the Affordable Care Act or these Medicaid expansions, we have still more opioid deaths and fewer people getting the addiction treatment they need. So that is what really needs to be focused on.
Roger, what do you think? What's your solution?
I partially agree with the doctor. I will say, though, that the road to recovery is long and the climb is very steep. That road is made much longer and much more steep when you remove health insurance from that picture of that family or that individual. Half our bankruptcies in this country are due to health care costs. So if you put those burdens on top of a situation that already has an individual dealing with addiction, then that whole situation becomes much more problematic. The president's focus on the border, I think, is a 20th century approach to a 21st century problem. It has no impact on ports, for example, where we believe much of this is coming in. So I don't necessarily agree with the president's prescription on this, but I think it's honorable that they're identifying it as a policy challenge.
And Dan, what about that? The president last night in Texas, he talked about, obtaining $6 billion to fight the opioid epidemic. What do you think is the solution?
I think by any measure, any empirical measure, the war on drugs has been a complete failure. I think the federal government of the United States, in our constitutional framework, has limited policy responses. I really don't see the American people putting up with an idea of executing dealers for throwing dime bags. I think that the founding fathers would probably roll over in their graves if they thought that the federal government was in the business of saving people from themselves. I think the federal government's primary responsibility is to preserve the sovereign border of the United States. The border wall is not the complete solution, but it's clearly a step in the right direction. I also think Majority Leader McCarthy's Build the Wall, Enforce the Law Act is also going to be helpful, because it's dealing with some of the criminal element that are already here, and the Sanctuary City movement, as well as funding the border wall.
And let's talk a little bit more about that, Dr. Saphier, in reference to the border wall, and if that is just the beginning in terms of stopping the flow of drugs coming in.
Well, President Trump right now is acting like the only lifeline for Nixon's war on drug, because he's going before this report was even released, and he is already trying to make movements. Building whether it's a theoretical or an actual border wall to stop drugs, we need to stop drugs from coming across our southern wall or southern border. Also, we have some coming from our northern border, and they're coming in our U.S. Postal Service, and they're coming legally from Europe. So a large amount is coming from our southern border, and absolutely by having strict border control there, it will decrease the amount of illegal drugs in our country. But it needs to be bigger than that. We can't be stuck in that microcosm.
Roger, I want to ask you about this as the Democrat on board this morning. Do you think it's wise for some Democrats to be calling for the abolition of ICE when we have this issue coming across our border?
No, is the short answer. No, I don't think that anyone who's serious should be calling for the dismantling of ICE at all.
Okay, and Dan, you get the final word.
You know, I think we spend a lot of time talking about the supply side of this, but really the tragedy is the demand side. People are not addicted to drugs for their pleasure-seeking. It's really to mask pain. And I think the human condition is a very difficult circumstance, and I think probably, you know, we have to have a great deal of compassion with these people.
Yeah, I mean, it's a tough topic to talk about in such a short amount of time, because you have to talk about these drugs being prescribed to begin with and alternatives to them, as I know Dr. Safar, you and I have talked about before.
One of the big things that came out of the report was saying by having economic growth, that is what will really get a lot of people out of poverty and out of being susceptible to addiction. So economic growth and focusing on our economy may actually also help our war on drugs.
Thank you all for joining us.
you.
Definitely appreciate it.
Thank you.
Worthy
Thank
topic
you.
this morning.